everyone. Welcome back to Clinicians Brief, the podcast, where we get to have the conversations behind the content. I'm your host, Dr. Alyssa Watson, and today we're talking about localizing thoracic limb lameness in dogs. Our guest is Dr. Kate Barnes. She's an associate professor of small animal orthopedic surgery at Texas A&M University. She recently authored a detailed step-by-step guide that can really help general practitioners like myself get the most out of their forelimb orthopedic exam. And we're going to go ahead and link that down below for anyone that wants to check it out. But I'm super excited to have her here because I certainly know for myself, when I'm identifying and localizing lameness, especially in the front leg, that can be a little bit challenging. And so I'm excited that she's here with us to share some valuable insights, tips, tricks on how to approach this really important examination. So thank you so much for joining us, Dr. Barnes. How are you today?
I'm doing great. I'm very excited to be here. I'm excited to talk about this subject too. I think sometimes it can be a little intimidating. So hopefully we can shed some light on it and make it nice and accessible and less intimidating for everybody.
That's wonderful. I'm excited that you're excited to be here with us. Before we jump into all of my questions, and there's lots of them, I promise, would you share a little bit about your background? How did you end up at Texas A&M? Our audience really likes to hear a little bit about our guests.
Yeah. So I'm originally from Connecticut, and I kind of bounced around a lot before I got here. I started vet school at Ross University, and then eventually transferred after about a year and a half to Oregon State University. After that, I did an internship at Cornell, residency at Virginia Tech, and then was on faculty at LSU for about 2.5 years, and eventually found an opening at Texas A&M. And I've been here for, doesn't feel like this long, but a little over 5 years that I've been here. And so it's definitely a bit of a change from Connecticut and kind of all of the other places where I've lived, but really starting to like it. Great people, great university, great program. And so happy to call Texas my home for right now.
That's wonderful. It does sound like you've jumped all around the whole country. So
yeah, yes, mostly around the coastal ones. Haven't ventured into the center as much.
The mid. Oh, well, I was born and raised in Iowa, and so I received my DVM from Iowa State University. So yeah, right smack dab in the middle.
Yeah, nice. Well, I haven't been there yet, but hopefully can at least come and visit at some point.
Yeah, absolutely. They'd love to have you down in Ames, that's for sure. Let's talk a little bit about gait examination. So the article is great. It talks about, kind of this ideal area for where we want when we're taking dogs, we're looking at how they're walking when they present for lameness.
Yeah, and so the gait exam is really important. And I think sometimes because owners maybe know that the dog is lame but don't know which leg, or they decide it's the left leg, but it's, their left leg as they're looking at the dog. So it's really helpful to kind of confirm that the dog is lame and confirm the affected leg. Sometimes there's even multiple legs when the owners only pick up on one. And so if you are able to get a good area, a good space where you can get distraction-free viewing of their gait, it's really helpful. That being said, the first time I really look at the dogs is when we're in the room talking to the owners. Kind of say hi to the dogs, give them a pet, and then I just kind of pretend to ignore them and let them move around. A lot of times as they're relaxed, sniffing around, sitting, standing, laying down, you'll be able to pick up on things when they don't necessarily think you're paying attention. After that, I think it's really helpful to have an area that doesn't have a lot of stuff going on. And sometimes that's challenging in the vet clinic, right? There's always stuff going on everywhere. But even if you have a hallway to take them to, if you have an area out in the back that you can take them to be able to watch them walk, it can be helpful without a lot of cars going back and forth, animals, people. And the easiest one for forelimbs is watching them from the side and then watching them come towards you. The other really important thing is a handler that knows what they're doing. So owners are fine as long as you can give them just a little bit of training beforehand. But if you have an experienced technician, that can be really helpful as well. And so especially with forelimb lameness, you want the dogs to be walking towards you without pulling on the leash a lot. If they're putting a lot of pressure here, a harness or a leash, then they tend to take a little bit of that weight off, and it might make that lameness even harder to identify. So we usually have people walking them, and sometimes those really excited dogs, it's hard to keep them going in a straight line. So maybe we want to take them on a lap or two just to get them used to what's going on. And then if they start to veer off, just doing a little correction to bring them back and then giving them a looser lead will help to decrease some of that pulling to be able to identify it. And I think whenever I say, I'm just going to look at them in our treatment area, I always regret it. They're sniffing, they're running everywhere. And so if you really want to get that good view of them, trying to get to a distraction-free area that's long enough to really watch them walk, I think is really helpful.
Yeah, absolutely. I mean, when I think of when I learned to do these exams, it was in school. And so we had these wonderful, beautiful hallways that went on for, meters and meters. And you could really watch them walk for a very long distance at all different angles, like you're talking about.
Mm-hmm.
But then when I got out into practice, now I'm in a treatment area with, a table in the middle, and there's cages over here with dogs and cats, and they're sniffing everywhere. And it became much, much more difficult. And we are, not a urban area, but in Las Vegas, which is where I practice, we're in a pretty suburban area. And so taking them outside isn't always feasible, especially in the summer when the pavement is 130 degrees. And so I found that really, really challenging when I got into practice, not having just that really ideal area with a long straightaway. So could this be a time where one of the nice things about practicing now is that everybody seems to have cell phones, and everybody, can, take a video. So is that, a strategy that can be utilized? And if we're doing that, what are you telling the owners to get for you on video before they bring the animal in?
Yeah, and the videos are really great, and I love the age of having cell phones and videos around. And so particularly if you don't have a good space for it, or even if you have a good space for it, sometimes the dogs just aren't very lame when they're at the vet clinic. They're amped up, they're excited to be there. It's kind of like bringing your broken down your car to the mechanic. As soon as you drop it off, it stops making that sound, right? And so if the owners have a video of the dog at home, that can be helpful to confirm the lameness and confirm the limb. And so I have found if I just ask the owners to bring in a video, I get this blurry, everything's moving around. It's hard to see. And so usually when we're asking the owners to take a video, I'll say, whoever has the camera, you stay still. Usually crouch down to get the camera down on the level of the dog. And if there's a second person that's available, have that person walk the dog back in front. You can move the camera a little bit, but you don't want to be kind of walking and chasing the dog with it. See if we can walk the dog back and forth ahead of it, and even walking the dog away from you and back in. If the owner's by themselves, they don't have a second person, they can also see if they can just prop the camera on something, and then they can walk the dog back and forth. And I think that that's really helpful, especially those cases that are really hard to see the lameness, or maybe they are only lame after, playing ball for 2 or 3 hours. And so, not lame that day at the visit at all, but absolutely the cameras. And in the cases where we don't have a big hallway or a big space to watch gait, use the space that you have, even if it's not ideal. Even looking at them in the exam room as they're walking in from the waiting area into the exam room, those can be opportunities to look. And even if they're not ideal, can often give you some information. And that's a conversation with the owners as well. I've had dogs that come in that I don't see a lameness. And so you have to use that owner information, the owner history, any videos that are there, and then use that to guide. And I always warn people, there may be something that we're missing here if we're not seeing exactly where that lameness is on this day, but we use the information that we have. And I think that's kind of veterinary medicine in general, right? You just use whatever resources you have at that moment to guide you, and hopefully you're going in the right direction.
I've absolutely had that situation, not just with lamenesses, but with other things too, where
Yeah.
people point out a bump or something, and I'm like, I'm just not seeing it,
Yeah.
so
Yes.
when we do have those forelimb lamenesses, and this is probably I did go to Iowa State University and I actually tracked a little bit equine. And when I was first in practice, I did some mixed animal medicine. And so, but down on sound, that is the one thing that I take away from forelimb lameness for my
Yeah.
whole life. So, can you even just kind of walk us through where that phrase comes from? And
Yeah.
what are some other specific gait characteristics we want to be looking for when we are zeroed in on the forelimb as the cause of our lameness?
Yeah. And so, whenever I'm thinking about the lameness, I kind of think about it for myself if I had a foot that hurt or a leg that hurts. We don't walk on our front legs, but so I'll use my back legs as an example. I used to sprain my ankle a lot when I was a kid. So, if it hurts when you put that foot down, as that foot is coming down as you're walking, you're going to use your stronger leg to push up and maybe help carry some of that weight forward so that you don't have to put as much on it. And then as you get through that stride and your kind of comfortable sound leg hits the ground again, you kind of drop back down because it's more comfortable being on that side. You no longer have to take that weight off of it. And so if you're watching the head of a dog or the front half of the dog as it's coming towards you, when that uncomfortable leg hits the ground, the dog's going to try and push off, shift that weight up. And then as the sound leg hits the ground, it'll finally drop back down. And so if you're watching that head, every time the head comes down, that should hopefully correspond with when that sound leg hits the ground. And sometimes it can be challenging to pick up. And so usually when I'm looking at it, I'll just kind of look at first and see whether it looks normal or abnormal. That's kind of my first question. Is it normal? Is it abnormal? If it's abnormal, then I'll look at the head pattern, look at up versus down. And then oftentimes I'll say it in my head as I see it. So down, down, down. And then I'll look at what leg is hitting the ground when that happens, just to kind of help to figure out which one is which. And this is another instance that having a video camera can come in really helpful. So if you're having trouble seeing it, especially in those like a little Chihuahua or Shih Tzu or something that's right, those are really hard to see. Yeah. And so sometimes if you can even get a little video of it and then watch it, move it slowly, that'll be a little bit easier to see which leg is hitting the ground, either when the head goes down or the head goes up. Other times that it gets a little bit challenging is when they're bilateral lamenesses. And so you might not necessarily have that up versus down. But if you do, it can be very helpful to kind of pick out which leg it is. Other things that can help decide if there's a leg that's lame, you can look at the gait. So again, if we think about if we're putting weight on a limb that hurts, we're not going to want to put a lot of weight for a long time on it. And so usually that stride will be a little bit shorter than the other side. We might be a little bit more stiff. We might not want to move a joint that hurts as much. You can also think about the position of the legs. And so a dog's going to put more weight on the leg if it is further towards midline. So that's going to be further under their center of gravity. If it's uncomfortable, they may put it a little bit further out to the side. So kind of eccentrically placed so that they don't have to place as much weight on it. And all of those things can kind of help pinpoint either which leg is lame or do we actually have both front legs that are lame, especially if we don't have that head nod or head bob to tell us one versus the other.
I think everything that you just went through, the shortened stride, eccentrically placing the limb, I think I could probably differentiate all of those a little bit better on a video. And so even if I do have the animal there in front of me, I might start taking more videos of them just for myself so that I can go back and slow them down and look at them. That's a really great tip and probably something I'm going to use in the future. So
yeah, it's helpful too with the owners if they think that a leg, maybe it's a different lameness, to look at a video together, even watch the dogs walk together. And sometimes when you think you're on different pages to begin with, all of a sudden you'll find out you're on the same page again. So yeah, it's very helpful. I love pulling out my camera and taking videos. My techs make fun of me all the time because they kind of roll their eyes and they're like, oh, it's picture time, it's video
It's
time.
video time. Yep, video
Yep.
time again.
Yep.
You also talk about assessing the limbs when they're in what's called, what you call a neutral standing position. So can you describe that for us, and what clues are you looking for when the animals are in that neutral position?
Yeah, so I'll often just have the dog stand on their own. So I don't try and pull them one way or the other. I'll just have them stand up and walk a couple steps and then just stop and look at them. That helps a little bit just in terms of looking at weight bearing. So sometimes if they're bearing more weight on that leg, you'll notice that metacarpal pad will be pushed a little bit closer to the ground. You can also look for the angle of the legs. It's great to look for symmetry from afar. So do we have an angular limb deformity? Do we have one of the carpi or both carpi that are dropped a little bit more than normal? And so are the elbows turned in or turned out? Are they placing their feet towards midline, or is one placed a little bit further away? Kind of helps to give little extra clues to are they placing less weight on this leg? And B, are there any other things that can help pinpoint to what area on the leg might be uncomfortable or at least abnormal for that dog?
And then you say that this is a kind of a nice time to insert just a quick neurologic exam, because unfortunately there are several neurologic disorders that can really mimic, musculoskeletal diseases, especially when I find more so front limbs as opposed to, hind limbs. So could you just tell us just a few, I know you're not a neurologist, but a few things that we should be looking for with that neurologic exam, and what are some of those disorders that we need to kind of keep on our list?
Yeah, absolutely. So I think probably two that we see, I guess maybe not a lot, but two big ones that I would always keep in mind would be cervical myelopathies and also peripheral nerve sheath tumors. And so both of those can be a little bit challenging, especially peripheral nerve sheath tumors, because if they're small, we might not also be able to pick up things on exam. We may just be ruling out other things and then still have this in the back of our mind as a differential. And so whenever the dogs are in their standing exam, I usually also take a feel of the neck, so palpate down, check neck range of motion, and then also check placing on the feet. We're lucky at the teaching hospital, we have a great neurology service that's there. And so we often work together with these cases, even if we see something that there could maybe be an orthopedic cause for the lameness, but we're not quite sure if it really explains anything, then we can go over and have them take a look at it as well. But if that's not available, which it isn't always, being able to do at least that cursory neurologic exam and rule out kind of obvious changes is really helpful. And then in some cases, if we get to a point where we don't have obvious orthopedic disease, maybe we don't have obvious neurologic deficits, then we have to talk about maybe trying to go ahead with other types of imaging. And I think those cases are probably the most frustrating. But if we can at least identify the cases that maybe have some neurologic deficits, then that will help us direct the owners for what the next step in the workup might be.
Yeah, absolutely. Getting them prepared, with what we might need to follow up with if, some conservative management or something like that doesn't work.
Mm-hmm.
Do you find that there are, we're talking about doing this kind of standing exam or neutral standing exam. Do you find that there are certain joint or muscle abnormalities that are easier for you to feel or palpate when the animal is standing, as opposed to when we have them lying down in lateral, which is where I kind of think of the meat of the exam is, manipulation and feeling everything.
Yeah, and I totally agree. I think the recumbent exam is often one of the more helpful parts of it. And the standing exam is really great for looking at symmetry. So if you can feel both of the legs at the same time, you might feel that one joint has a fusion and the other elbow joint doesn't. You can feel for muscle atrophy on one side versus the other, particularly over the scapular spine. It's also really helpful looking at things like the carpi to see if the carpi are dropped. And to look at the position of one leg versus the other. So maybe it's a young dog that had a growth plate injury that wasn't displaced, but maybe the growth plate was still injured. And so maybe they have a little bit more carpal valgus on one side versus the other. And so anything where we just want to see, again, having the dog stand, we don't want to make it stand in any way. We just want to see how it's going to place those legs naturally. But we can check one versus the other. And sometimes that can help to pick up more subtle differences in the limbs versus when we're just feeling one on its own.
And then talking about that recumbent exam, because it is so important, does it matter what side the dog's laying on? I assume that it does, but do you always want the affected limb up? Do you always want them in the same position, like right lateral regardless? How do you go about that recumbent exam?
Yeah, I would say if this is a well-behaved, cooperative dog, that I try to look at whatever leg I think is lame last. So if it's a left forelimb lameness, I'll put the dog in left lateral recumbence. We'll feel the right side first, flip the dog over, then feel the hind leg on that side first, and then that lame leg last. If, though, we have a dog that is maybe minimal minutes that we have to examine him, then I might put the dog down with the lame leg up and just feel that one first, just to make sure I get a good feel of it. And then if we can feel in the other legs, do that as time permits. But typically, I do the lame leg last, and mostly I just worry if we do something that hurts the dog or they're uncomfortable, then it may make the rest of the exam a little bit more difficult.
Yep.
Yeah, and so I do think it's helpful to feel, even though we're not feeling them both at the same time, you can still get some idea of symmetry with movement of the joints. And so it's nice to feel the whole leg. We also sometimes get dogs coming in for one particular problem, and then find out that they actually have issues in the other legs as well. So I try to do the whole dog, and just their personality helps to dictate which leg I look at first.
Finding the right veterinarian can feel like trying to find a needle in a haystack. The Clinician's Brief Career Center makes it easier to reach the perfect new hire for your practice with employer profiles, resume search, and twice monthly email promotions to more than 120,000 veterinary professionals. Find the right hire for your clinic at cliniciansbrief.com/career-center. So you also talk about starting your palpation distally and then working proximally. So what is the rationale behind that? What are you looking for there?
Yeah, one of the biggest reasons is that it's much easier to isolate joints that are distally on the limb compared to further proximally. So once we get to areas like the shoulder, it's really hard to be able to flex and extend without also manipulating the elbow. And so if we can start distally on the leg and rule out maybe those joints and those bones as we come up, then that'll tell us, if we get to the shoulder now and there's discomfort, that's likely going to be related to the shoulder versus anything more distal. The other thing the other reason that I like to do it is that it helps me do it in exactly the same way every time. So if I start at the distal part at the toes and work my way up, every single time, I'm much less likely to forget something or to leave out a test or leave out palpation of a joint if it's all consistent. And so starting in the same way and doing it at the same time, that repetition, I think, is really helpful.
Yeah, that makes sense. What types of reactions are we really looking for from the animal in order to determine that that they're reacting to the palpation? We always say, look for a reaction. Well, what am I looking for?
Yeah, sometimes it can be a big, obvious reaction, like the animal crying out and seeming painful. But other times it can be a lot more subtle. And so I'll usually look at the dog and check, are they trying to pull that leg back a little bit when I do this? Does their breathing pattern change a little bit? And sometimes it's hard to know if there's a distraction somewhere in the room and their breathing pattern changes or they kind of flinch. Maybe that wasn't related to my exam. So if there's anything subtle that I see, I'll just wait a couple seconds and then feel it again, see if we get the same reaction. If I'm still not quite sure, if I get inconsistent results, I might just finish looking at the rest of the leg, give the dog a couple pets, and then come back to that joint or that bone and feel again and see if I get something, some type of reaction. And the biggest thing is just, is there some type of change in what the pet is doing, and is it repeatable? So if it's just one time, I might, lay that to just chance, or maybe they're shifting positions. But if it happens multiple times, then that leads me more to think that, hey, this might actually be where the issue is coming from. But yeah, it can be subtle. And sometimes it's helpful if you do have somebody that's helping to hold the dog that is experienced, like a technician that's used to it. Our techs will watch the dog as we're palpating and say, hey, when you got to that spot, they actually kind of looked over at you,
Mm-hmm.
or their breathing pattern really changed. And so having that second set of eyes, if you have it, can be really helpful as well, especially in those cases where it's a really subtle reaction.
Sure, yeah. Because oftentimes I'm focused on the area that I'm, my vision and my focus is on the area that I'm manipulating. And so I might miss
Yep.
something, if they move their head or hold their breath or something like that. So that's a really good point, as well as, having somebody else there that's watching the exam and can say, oh yeah, we had a little reaction there. So
Yeah. Yeah, absolutely. And I think our technicians, I don't know how I would get through the day without them. I mean, they're fantastic. And the experience that they have just, makes my job easier.
right.
And so sometimes if we have new people coming in and students as they're learning, sometimes it takes a little bit to get that experience in. But usually, I'm very quick to say for our technicians, hey, give me your feedback too, because sometimes, like you said, I'm focused in on something, and there may be things that I miss that they pick up on, especially since they're holding the dog too.
Yeah.
They can kind of pick up on subtle body tenses and
Mm-hmm.
and things like that.
Mm-hmm. Absolutely. When you're doing this exam, because I've heard conflicting things before about which to palpate first. Should you palpate long bones first, or should you palpate joints first? So which do you do and why?
So I just follow up the leg, and so whichever I get to first, I'll palpate those. So I get, phalanges, and then the joints, the metacarpal phalangeal joint, metacarpals, carpus, radius, and ulna. So I just follow all the way up the leg. And if I get to a point where it seems uncomfortable and it's maybe around the joint, I might go back and feel kind of the bones surrounding the joint and the joint itself again, just to try to suss out which one of those was uncomfortable. But mostly I follow up the leg and kind of alternate joints and long bones as we go.
And then we had talked a little bit about other diseases, that can mimic musculoskeletal disease when we talked about neurologic diseases. But another one we find is sometimes dermatological diseases or disorders, especially that cause pain or discomfort around the claws or the foot pads. I mean, we absolutely will see lameness with those. So what are a couple conditions, or what should we be, making sure we're doing around specifically those areas like the foot pads and the claw beds?
Yeah, and so these can be a huge source of pain. And I think especially as the issue gets further distal on the limb, sometimes the dogs are even more painful. And so it is really important to check around the nail beds, check the paw pads, looking in between the toes for foreign bodies, irritations, things like that, because that can be a source of lameness. Um, I made you promise beforehand not to ask me a whole lot about dermatology stuff, because that is certainly an area that I don't know very much about. But I'll always make sure to look for it, and anything weird, checking in with your friends that know more about certain subjects than you is always a good option. And so, we may run down to our derm service to check with them and see what's going on. But I think the biggest thing there is if you can see that there's something abnormal there, and especially then if you can rule out anything else on the leg, that kind of helps to decide that really that lesion on the paw pad or between the toes is probably significant. And so, making sure that we don't go on a crazy hunt when there's something like a broken toenail, I think is helpful. The other thing, if there is some derm issues or other things, checking all of the paws as well. So sometimes if they do have something, if they have it on both front legs or, other paws may give you an indication that there's something else going on besides orthopedic disease.
So now I'd love to talk about a couple of specific tests and palpation techniques that you detailed in the article. This is another place where I really feel like my strength lies in the back limb. I can do a cranial drawer, I can do a tibial thrust, I can do an ortolani, but there's actually some specific stress tests and things like that for the forelimb that I just really wasn't familiar with. So could you tell the audience about the Campbell's test and how we do that test?
Yeah, so the Campbell's test is a test that we can use to check for instability of the elbow joint. And so the elbow joint in general is a very stable joint. It's intrinsically stable. And part of the reason that it is, the collateral ligaments, the surrounding soft tissues, but also the anconeal process. And so when the elbow is extended, that anconeal process comes over and kind of hooks over the humerus and helps to keep the elbow joint together. So if we want to check for any instability related to the collateral ligaments, we can flex the elbow, so that brings the anconeal, kind of disengages the anconeal process, and then pronate and supinate the foot. As you pronate, you can feel on the medial joint surface to see if it opens, and then when you supinate, you can feel on the lateral joint surface to see if that opens a little bit as well. There is some variation from dog to dog, different breeds, different sizes, and so comparing one to the other is helpful. And then also comparing, even if you have a dog that you don't think there's instability, try the Campbell's test on them, see if you can feel how much the joint surface opens. And you start to build your baseline of what that normal feels like. And that can help to pick up things that are abnormal.
Yeah, I think that's another just good tip when it comes to everything, looking at normal. So do it the same way every time, look at the normal, and then you're much more likely to recognize when it's abnormal.
Exactly. I remember the first time I felt an abdomen when I was in vet school. It was squishy and I had no idea what I was feeling. And then it takes, by the time you're out, your first couple of years, you get a lot of practice in. Now you can find kidneys, livers, all that. So same thing goes with the thoracic limbs and the pelvic limbs. You just gotta feel it, commit to doing it, and you'll be able to pick up the normal versus abnormal. Absolutely.
So can you tell us a little bit about the biceps test as well? Because that's another one that you detail really nicely in the article.
Yeah, and so especially as we get into kind of middle-aged to older dogs, they can certainly have pathology with the biceps tendon. And so one of the ways that we can try to isolate it kind of separate from the shoulder joint, so trying to see if there's pain in that area, is to do the biceps test. And the biceps tendon extends from above the shoulder, so at the supraglenoid tubercle, and comes all the way down past the elbow joint onto the radius and ulna. And so if we want to put some maximal tension on it, we can flex the shoulder and extend the elbow at the same time while palpating that tendon in the intertubercular groove on the medial aspect. And so often dogs that have a biceps tendinopathy will react when you do that. The other thing I would always mention is that the biceps tendon and issues with the biceps tendon can be a primary issue, but could also be secondary to something else going on in the leg. And so even if I get some pain on the biceps tendon with that test, I'll always still feel the rest of the leg and make sure that we don't have any other abnormalities. We often see dogs that have kind of elbow dysplasia and some, secondary chronic arthritis that develops there. Will also get some biceps tendinopathy. I think probably because they're uncomfortable on the legs, they change how they walk. Maybe they get a little bit more stiff in the shoulders. So sometimes it may be secondary to other things. And so I always make sure that we make sure to evaluate everywhere else that could have a problem. And often, if we have some elbows, may need to address those as well, in addition to the biceps tendon. So the test is very helpful. Identifying that there's issues there are very helpful. But also making sure that we don't have something else brewing is especially important as well.
So we've talked about a lot of things. We've talked about the gait exam. We've talked about the recumbent exam, doing a quick neurologic exam, checking the paw pads, doing some of these, tests, the Campbell test, the biceps test. So can we really, as a general practitioner, a lot of us have 15-minute time slots, So obviously, the more you do them, the more efficient you're going to be, the more normals you check. Like we said, the easier it is to recognize something that's abnormal. But if, in a perfect world, how long do you think a full, orthopedic exam of the forelimb should take?
Yeah, I'm going to answer that with it depends. I think if you have, again, that well-behaved dog, good support
Mhm.
from somebody to help hold, I think that you can probably get a quick gait exam and you can get a good palpation standing and recumbent in your, a 5-minute time period. If we get to the point, though, where the dog's not cooperating very well, we can't get a good exam, maybe they're fighting us every time we try to feel the joints, or if it's something really subtle that we maybe have to go back again and try to feel, those can certainly take longer. And so I've definitely had cases where we just could not get a good, and then at that point, appointments are backing up,
Mhm.
techs are looking at their watch, giving you the stink eye. And so you have to keep moving with your day. And so I have had some of those cases where I've just asked the owners, I've just been honest with them. Hey, your dog's it's great. Your dog's so excited to be here. But we can't quite figure out where the pain is coming from. Would you be able to just leave him with us for a couple hours? We'll go see some appointments and then we'll come back maybe when he settles down. And then try to do the exam again and see if we can figure out what's going on. And so, in some of those cases, it may stretch out a little bit. And if you don't have time that day, I also think it's reasonable, if you've at least seen that the dog is putting some weight on it, you've done a little bit, but not a thorough one, we can say, hey, I don't think there's any, broken bones. Great. But we might need to schedule a more thorough, longer exam for another day. I think that is reasonable as well. And so sometimes you don't know what you're going to get right when it comes in. And so you may get lucky and be able to get through that exam in a short period and be able to go over some options. But if not, then hopefully the owner would be able to work with you in terms of finding time to get a little bit more thorough exam. And we certainly have those cases that can be frustrating. And I think, if you've seen a case of a forelimb lameness and haven't been able to figure out where the source of lameness is coming from, you're in good company, right?
You're
Like
not alone.
everybody has seen, yeah, everybody has seen a case. Doesn't matter if you're a general practitioner or a boarded surgeon, you've been out for 6 weeks, 6 months, 6 years, 16 years, you're going to see cases that are very hard to figure out what's going on in. And so the most that we can do is at least run through kind of our exam, rule out some things. But if we do need more time or even more diagnostics, I think it's reasonable to have another day and time set up if needed, if you're going to need more time with that particular case.
And I think kind of bouncing off that a little bit, and we do sometimes have these patients that are just so stressed, even if they're not particularly painful can be, an issue as well. But ones that are just so stressed, those ones that come into the clinic and freeze, that you can't get them to move at all. And
Mhm.
so the final thing I'd like to talk about is a little bit about some of these more anxiolytic medications. So gabapentin, trazodone, these are lots of things that we use to facilitate examination, especially in dogs. And so can you talk a little bit about if we need to use those medications, do we need to modify our exam protocol? How do you handle those dogs that are incredibly anxious?
Yeah. And, the good thing about orthopedics is most of our patients are young and healthy. The bad thing about orthopedics is most of the patients are
Young
young
and
and
healthy.
healthy and crazy. And so it does make it challenging. And I think I use trazodone a lot, especially for postoperative patients. And we do get those cases that come in that are really hard to examine. And if we know that ahead of time and the owners have trazodone, I think that that's helpful. And so the balance, though, is that we want them to be less anxious and more comfortable being with us, but not so drugged that they're having difficulty walking or that they're looking a little ataxic. And so finding that balance is sometimes a little bit challenging. But trazodone, I think, can be helpful. Gabapentin can be helpful. And I do usually just warn owners, we may be missing some subtle sources of pain that are maybe being hidden by the medications. And so, it's a balance with it. But I think it's more important that we're safe also, that the dogs are safe. We don't want to get bitten in in our attempt to do a good ortho exam. We want the dogs to not be so stressed that they're getting heat stroke in the corner, because panting and heating themselves up. We want everybody to be able to have a good experience there, as good of experience as possible. We've also had cases that are so aggressive or so anxious that we just can't even touch those dogs. And so in those cases, I have talked to the owners about doing basically full sedation with them in order to be able to do an exam. The downside of that is they won't be able to tell me where they're painful. And so every time we do the exam, it's really helpful. If a joint is abnormal, is it painful? Can I localize the pain to that area? If it's not, but maybe they're painful somewhere else, that helps decide where to target treatment. So when they're completely relaxed and sedate, we're basically just looking for abnormalities along the soft tissues or the bones to then go after treatment or diagnostics and treatment. And so again, for the owners, it would be saying, we might be missing a source of pain if they're sedated, but this is what we have to go on, and we can try this and see if it works. If not, we'll have to come back and reevaluate it. But certainly, the other thing that I've realized is that some owners will have some trazodone from another animal or another vet visit. And so they may give it and we don't even know about it. And so it is interesting. I don't know how much it changes the exams. So hopefully not very much, but maybe there's a little bit of blunting of a pain response.
Well, that was all of my questions. I really appreciate you coming on today and talking with us. We do have one little fun thing at the end of our episodes. At the end of all of our podcasts, we like to play a little game. It's really easy. There's no right or wrong answer. It's kind of just some would you rather questions. And so if you'd like to play, we can get started.
Yeah, let's do it.
All right. So would you rather practice without arthroscopy or without one of those really awesome vessel sealing devices?
I guess, I'd probably say I'd rather practice without the vessel sealing device.
You got to have
just
your
because
arthroscope.
Yeah. Oh my gosh. Yeah. I love our scopes. Got to keep that. But that's, I don't know.
Yeah.
I did have to think a little bit on that one.
Would you, well, I don't have a vessel sealing device or an arthroscope, so it wouldn't be hard for me.
Yeah.
Would you rather have to repeat your residency or repeat high school?
Probably high school.
You'd go back to high school?
I got more sleep in high school, I think.
That's true.
I didn't get called in the middle of the night. Yeah, unless there's anybody listening from my residency, in which case I'll repeat residency. No, I don't. That's a hard one too. I'd probably go with high school just so that I could I could sleep through the night every night.
That's a good answer. That's a really good,
Yeah.
you have some sound reasoning behind that.
Yeah, thank you. Thank you very much. I appreciate that.
Okay, would you rather invent a new surgical procedure or would you rather discover a novel class of analgesic drugs?
Oh, ooh. I mean, being a surgeon, I'd probably have to go with the new surgical procedure, but the analgesic drugs would be a good one too. Yeah, those would be awesome. But yeah, I mean, if just because of being a surgeon, I'll
Yeah.
go with the procedure.
All right.
Something cool.
All right, last question. If they were both still alive, would you rather perform surgery on a saber-toothed tiger or a stegosaurus?
Whoa. I feel like I'd go with a stegosaurus.
Right? It'd be so cool. Like, I don't
Yeah.
thick skin
Oh my
though.
gosh.
Like,
It would be. It would be a learning experience. But yeah, that's a good question. I would have to go with that. Yeah. That would be weird.
well, good. I'm glad that
Dive
you
in
liked
there.
it. Yeah.
Yeah.
All right. Well, that was everything. Thank you again for joining us. Thank you so much to our audience for joining us. I hope you all enjoyed this discussion just as much as I did.
Thank you. I appreciate it.
Thank you for listening to today's episode of Clinician's Brief, the podcast. If you enjoyed this episode, you can find us wherever you listen to your favorite podcasts, including a video version that's available on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@briefmedia.com. Clinician's Brief, the podcast is a VetMedics production, produced by Alexis Ussery and hosted by me, Dr. Alyssa Watson.